Welcome everyone to the third episode of GPCCI Insight, our podcast that sheds light on what moves different sectors in our membership and beyond, as well as giving the industries not only a voice, but also let them share their experiences and inform others that might be on the same boat. I am Tobias Peterson from GPCCI, and today I have a special guest here with me, virtually of course, Ms. Stephanie Franco, Managing Director of Fresenius Medical Care Philippines. Fresenius Medical Care is the world's leading provider of dialysis products and services, meaning that they're not only frontliners in the times of COVID-19 with their clinics, but also provide maintenance and repair services to hospitals that use the technology. While we are being safe in our homes, frontliners are taking the hit helping others so we can stay safe. As by the end of April, it was announced that 16% of COVID cases are actually healthcare workers. Especially in the field of medical care, you help us, so we are being taken care of in the worst case. So Stephanie, I personally want to thank you not only for being here with me, but also for the contribution of Fresenius. Hello, Stephanie, and welcome.
Good morning, Toby. Thank you for inviting me.
My pleasure. I would say we'd start right away about the general healthcare sector. So how was the healthcare sector before the crisis? I know that it has been growing over the recent years, and just before COVID-19 shook the world, a new law for universal healthcare was passed in the Philippines. So how was it before and how is it now?
So before the pandemic, as you rightfully mentioned, the universal healthcare law was passed by the Philippine president, and the implementing rules and regulations around that law were slowly being disseminated. And so before COVID-19, the industry was primarily moving along very well, as well as the growth of dialysis centers all over the country. That growth has been a strong double digit. So this is pre-COVID. So what happened when the pandemic came upon us? When you talk about chronic kidney disease patients, we are talking about a very vulnerable population because they already have a serious condition that requires chronic treatment. So a pandemic like COVID-19 puts them at a much bigger risk. So when the pandemic came upon us, it was just a matter of time, sooner rather than later, that there will be COVID positive in the dialysis population. But like other countries, this pandemic was really a nightmare, right? It's not something that we knew that it was going to come. And when it came, it came very suddenly. We were not really that affected by SARS and MERS, unlike other Northeast Asian countries. So for the Philippines, this pandemic are the first pandemic experience, so to speak. Of course, SARS and MERS, there were infections, but not to this extent that we are experiencing with COVID-19.
Yeah, the Philippines have never experienced anything like COVID-19 in any way. Like you said, there was not such a big impact when it came to SARS, not a big impact when it came to other pandemics or epidemics. So it was something that had to be addressed as soon as possible without any prior experience that the country had. So how has it impacted the medtech and healthcare sector, especially in your case? What were the initial challenges?
Yes, the primary challenge at the early phase was really the clinics. So first and foremost, we had to be prepared to have the proper clinical management protocols in place for a pandemic situation. So putting together the appropriate clinical protocols to make sure that we are protecting our patients and protecting our clinic teams. When our clinic teams, our nurses are affected, no treatments can happen. So It was critical that our clinic teams were protected in the best way that we can. So in the early phase of this pandemic, the start of the ECQ, we had to make sure that we got accommodation as close as possible to the clinics, because allowing them to go home would put their families and themselves at risk. So we had to get temporary housing because public transportation was not available. We also had to provide our own shuttle services for the clinic teams to and from the clinic to this temporary housing. So that was not easy. When the landlords realized that nurses were going to stay in their condo units or in their townhouse, they actually refused. They were afraid that having healthcare workers in their facilities would contaminate the rest of the building. So this was in the early phase. I think many people were really struggling with fear, with a lot of uncertainty, not understanding the disease. So that struggle was there. But we had to do what we had to do to protect our clinic teams. And so we had to find these resources for them. The other struggle was PPE, personal protective equipment. Because in March, China was the first wave, but the rest of the world, the onslaught of COVID was upon everyone else, right? And so all countries were scrambling for PPE. And the Philippines does not manufacture PPEs locally. So we had to source PPEs from other countries. So this was not an easy experience for us, Toby. We needed a lot of help from collaborating with our regional team. And like everyone else, I think we also experienced the spike in prices. The classical supply and demand situation came upon us. Sadly, a lot of opportunistic businessmen took advantage of the situation. So that was also a struggle for us. So there was the element of process. There was the element of protecting our clinic teams with the right PPEs and also clinical management. So we had to quickly implement changes in the way we did the patient protocol. So in our clinics, a triage had to be set up. The same way it is set up in the hospitals to properly filter the patient, whether they are normal, regular dialysis patients without any symptoms of sorts. But so a triage had to be set up. Proper filtering had to take place.
Yeah, so that would mean there are 3 different sectors, areas in the clinics, and then also different nurses taking care of different patients. Is that how it then works, or am I misunderstanding it?
Before COVID, you would have 2 or 3 shifts for dialysis in our clinics. When COVID was upon us, we had to dedicate certain shifts for what we would call PUMs, patients under monitoring or patients under investigation. So we had to make sure that there was a cohort. So you separate those patients under a cohort and you dialyze them in a specific shift. There was definitely a change in protocol, including the clinic disinfection, sanitation, to protect all patients. We had to quickly put all of these protocols in place.
Yeah, and at least now everything is set in place with the rules and regulations and the procedures. I think right at the beginning, there were even more challenges also with the passes. You've also mentioned before that your technical team, when they maintain and repair machinery that hospitals are using, had problems with actually passing through the through the borders?
Yes. So, in the early part of the ECQ, people were still scrambling, getting the right pass to be able to get past the checkpoints. So, in the case of our technical service engineers, obviously it was a challenge to get this rapid pass. It took us about 2-3 weeks, and we had to put the certificate of employment. That was quite easy. The HR generated all of that. Everyone was in a learning curve, so to speak, including the police, including the people manning these checkpoints, right?
Being a technical engineer doesn't really sound like you're working in the healthcare sector if you don't have the knowledge that actually these people are also part of the healthcare system.
Yes. But now, after the steep learning curve, those challenges we've already addressed, and the process is more stable.
I'm very happy to hear that. So you have your staff, in particular the nurses, staying closely to the clinics, so they are there. That took a while to establish the whole procedures.
One other support that we had to put forward, Toby, for our clinic teams was to provide them with psychological first aid. So they were together as a team in these housing facilities, but they were away from their families. And obviously, they are in the front line. They are really exposed. And so these nurses, the technicians in the clinics, they were very, very afraid to get sick. They were very afraid to contaminate their families. They were afraid to be away. So very normal. And so we had put together a psychological first aid program to really support the clinics. But I think that the mental health challenge was very real. To assure them that we were doing everything in our power to protect them so that they could do their work with the assurance that they were safe. The cleaning, the disinfection, the sanitation of the clinics. And I have to say, Toby, that to this day, we do not have a clinic team member who is COVID positive.
I was just about to ask whether you had anyone. I'm happy to hear that it's not the case, and that you're also taking care of the healthcare workers, of the nurses, because the people that take care of others also need to be taken care of, especially during these times. And now with the MECQ, do you see any changes in your operations and also in the healthcare sector generally?
Transitioning to the modified ECQ, there's very little difference. I think that the transportation is still very limited. We will continue. So our clinics will operate, and they have now passed the early phase where there was a lot of fear, a lot of panic. Now we are a lot more stable. We are following protocol to the letter. Our nurses have their PPEs. And I think they have gotten over the initial fears of the process. But for those that work from home, so these are the office-based teams, for the most part, we are in the healthcare industry, and there will definitely be urgent and critical processes. We have put that in place since the beginning of ECQ. So we will continue to do that. But we are definitely preparing for transition. We have a framework in place. The Department of Health has mandated that all companies formulate a COVID-19 policy. And we are using that framework in helping us on what we must do when we transition. So I have to say, Toby, that is still a work in progress at the moment. I want to be very prudent in transitioning. My inclination is we need to observe what is really happening. So that is my inclination. And if you see things that are working well, but some things may not be working well, everyone is on a learning curve. And so we have to be prepared to address all of those parameters.
Yeah, my next question would be about the outlook of the sector. I mean, there have been challenges now, and there have also been challenges that no one has foreseen beforehand. And you're also working closely with the Department of Health. Do you see new guidelines that need to be implemented or that have already been implemented?
I think, yes, a lot of things are a work in progress. Toby, Fresenius Medical Care, we are members of the Healthcare Technology Association of the Philippines. We are working with the DOH on certain like Senate bills. As an example, Senate bill like the Price Act, this idea that prices should not change during pandemics, right? So I think
Mm-hmm.
that is definitely a very good direction. Things like that. Also, the security and sufficiency of the medical resources. We are in the middle of a pandemic, but it doesn't mean that we do not look into the right legislation to protect the country from future pandemics. So there are definitely initiatives on that. A lot of medical equipment is required to address COVID-19. There is a
Mm-hmm.
percentage of patients that go into severe and critical conditions, right? So you think about ventilators. So definitely we need to think about this as an industry on how to make sure that the country will have enough of these resources and not scramble for them. Many countries scrambled for this equipment, even developed countries. Those discussions are definitely taking place. Yeah.
Stephanie, I have
Yes.
another question that is more coming from the recruitment aspect of nurses. Because how is the supply of the skilled personnel right now? I mean, the Department of Health has been frantically recruiting temporary health personnel, and now they're also giving monthly salary benefits and 20% premium. And I know that beforehand, there was really a struggle to actually find well-skilled. Quite often, they opted to become OFWs, to go abroad or for other fields. How is it right now? Did the crisis change that?
We actually have our nurses intact. During the ECQ, that there were sectors of workers who probably lost their jobs, or meaning if their work arrangement is such that no work, no pay. So people lost jobs, right? If the country tells you to lock down, you are not working. And so I think the government took care of that through the social amelioration package that was coursed through the DSWD and all of that. But in the case of healthcare, there was definitely work to be done because there are
Mm-hmm.
patients served. And so for Fresenius Medical Care, I have to say that our nurses are with us. Some of these nurses, under normal circumstance, they may have left us already because they have contracts to go abroad, but there are now limitations for travel, right? Yeah, our nurses have not left. We really made sure that our nurses are protected, that they are safe, that they are truly our heroes, that they are valued, their contribution.
Yeah, and I mean, you are heroes. You are a heroine, and your nurses really, really are heroes. And I want to thank you again for the support that you're giving to the country. Stephanie, thank you so
Uh,
much.
I myself feel very blessed to be part of Fresenius Medical Care, and that we are front and center of doing our part during this pandemic.
Yeah, that would actually end my podcast, or our podcast for today. And I want to thank you again for participating, and thank you for taking time to sit down here virtually with me and have an exchange about the medical field and what Fresenius is doing. Thank you very
Inviting
much.
Toby. Thank you very
No,
much. My pleasure.
it's my pleasure even more. And then what would leave me now still is saying goodbye and thank you for the listeners. And I wish for you and for everyone to stay safe and healthy.
Yeah. All right. Thank you, Toby. Stay safe and healthy.